Ladies, I've been in medicine for over 30 years, and I've seen it all: the good, the bad, and the downright dangerous. And today, I'm going to tell you about 7 medical tests doctors often push on senior women that you simply don't need, and in some cases could even harm you. If you've ever wondered whether your doctor truly has your best interests at heart, you need to hear this. Watch until the very end, because the last one is not only unnecessary, it's expensive, invasive, and designed to keep you coming back. Before we start, hit that like button so more women can protect themselves. Comment below if you've ever refused a test and why. And subscribe so you never miss my insider advice. 1. The annual full body scan. I want to start with this one because it's become a trend in certain private clinics, the so-called peace of mind full body CT or MRI scan. The idea sounds tempting. You walk in, lie down, and a machine scans you from head to toe looking for anything hidden that might be wrong. But here's the truth. For the average healthy senior woman with no specific symptoms, this test does far more harm than good. First, CT scans use radiation. Not a tiny amount, but a significant dose that, if repeated yearly, increases your lifetime cancer risk. MRIs avoid the radiation, but they're costly and still carry the same main problem: overdiagnosis. Overdiagnosis is when the scan finds something, a shadow, a small nodule, a cyst that's completely harmless and would never cause trouble in your lifetime. But once it's found, doctors feel compelled to investigate. That means more scans, more biopsies, sometimes even surgery, all for something that wasn't a threat in the first place. I had a patient, Margaret, 72 years old, who went in for one of these scans at a private clinic. They found a small spot on her lung, less than a centimeter. She had no cough, no breathing issues, nothing. That led to a needle biopsy, which punctured her lung and landed her in hospital for 4 days. The result: benign scar tissue from a childhood infection, totally harmless. She went through all that pain, fear, and expense for nothing. So unless you have a specific reason, a real symptom, or a family history that warrants it, avoid the annual full body scan. It's more about selling you fear than saving your life. 2. The annual stress test for the heart. This one is especially common with older women who want to stay on top of heart health. The treadmill stress test or the nuclear stress test, where they inject dye to watch blood flow to your heart, can be life-saving if you have chest pain, shortness of breath, or known heart disease. But here's the reality. If you're symptom-free, your risk factors are under control, and your last test was normal, doing this every year is unnecessary and potentially harmful. Why? Because these tests are not perfect, especially in women. False positives are common. A false positive means the test says there might be a blockage or reduced blood flow, when in fact your heart is fine. When that happens, what's the next step? Usually an angiogram, a procedure where they insert a catheter into your heart's arteries. That's invasive, requires anesthesia, and carries risks like bleeding, stroke, or even heart attack during the procedure. I've seen healthy women go from walking on a treadmill to lying in a hospital bed within a week, all because of a false positive. One woman in her late 60s came to me after a private clinic recommended a yearly nuclear stress test just to be safe. She had 2 false alarms in 3 years, and both times she underwent invasive testing that came back clean. Not only was it unnecessary, it gave her constant anxiety about her heart, even though she was perfectly healthy. If you're symptom-free, you don't need this test every year. A much better approach: maintain healthy blood pressure, cholesterol, and keep moving daily. Prevention beats overdosing any day. 3. Bone density scans every year. Osteoporosis is something I take seriously, especially for women after menopause. But here's the truth. Once you've had your initial bone density scan, you do not need it every year. Bone density changes slowly. We're talking years, not months. Doing the scan annually gives you no meaningful new information, but it can lead to premature prescriptions for bone-strengthening drugs like bisphosphonates. And while these drugs can help in the right situation, they come with serious potential side effects: jawbone deterioration, digestive problems, and, ironically, an increased risk of certain unusual fractures. Here's what happens when we test too often. A woman's bone density might drop slightly from one year to the next, well within normal variation. But because the scan flagged it as a change, she's told she has early osteoporosis and is started on strong medication she doesn't need yet. One of my patients, Linda, 69, was given an annual scan by her doctor because insurance covers it. After a tiny drop in her score, she was put on medication that made her so nauseous she could barely eat. We stopped the drug, rechecked her bone density 2 years later, and found it hadn't changed at all since the first test. Unless you have a major change, like a fracture, new medication, or a condition that affects bone health, you only need a bone scan every 2 to 5 years. Anything more frequent is testing for the sake of billing, not your well-being. 4. Excessive cancer marker blood tests. This one frustrates me because it preys on fear. Some doctors, especially in private clinics, will suggest regular blood tests for cancer markers like CA-125 for ovarian cancer, CEA for colon cancer, or even PSA-type markers for certain rare conditions in women. Here's the truth. These tests are not reliable for general screening. They are designed for monitoring people who already have cancer or are in high-risk groups, not for randomly checking healthy women. Why? Because these markers can be elevated for many totally harmless reasons: inflammation, infection, even a simple cold. But when that result comes back slightly elevated, the doctor often says, "We need to investigate further." And just like that, you're sent down a rabbit hole of scans, biopsies, and repeat testing, all for something that isn't cancer. I had a patient, Janice, 74, who was talked into a yearly CA-125 just for peace of mind. 1 year, her level came back slightly above the lab's cutoff. She was sent for a transvaginal ultrasound, then an MRI, and finally a surgical biopsy of her ovary. The result: normal tissue. She spent weeks terrified she was dying and ended up with complications from the surgery that took months to recover from. So unless you have symptoms or a known family history that puts you at higher risk, these tests can create problems that didn't exist. And here's a tip: if your doctor suggests a cancer marker test, always ask, if this comes back positive, exactly what will we do next? If the answer is vague, be very cautious. 5. Frequent colonoscopies without cause. Colon cancer screening is important. I would never tell you to skip it entirely, but I will tell you this: many women are having far more colonoscopies than they need, and it's not without risk. Guidelines in most countries say that if your last colonoscopy was clear and you have no family history or symptoms, you only need the test once every 10 years. Yet I see women being told to come back every 3 to 5 years just to be sure. That's unnecessary, costly, and potentially dangerous. Colonoscopies require sedation or anesthesia. The procedure itself carries a small but real risk of bleeding, perforating the bowel, or causing complications from the anesthesia. The risk may be small, but when you multiply it by having unnecessary procedures, it starts to add up. One woman I knew, Patricia, 76, had her first colonoscopy at 65, clear. Her doctor still insisted on another at 70. Again, clear. Then another at 73, during which she suffered a small perforation. She ended up in the hospital for emergency surgery, all for a screening that could have safely waited another 7 years. If your doctor suggests more frequent colonoscopies, ask them exactly why. Is it because of actual risk factors, or because that's just their habit? Remember, more is not always better, especially when the risks of the test itself start to outweigh the benefits.